all protocols have observed. Before I begin, I would also want to express my gratitude and appreciation to the organizers of this Community Health Week here at St. Paul's University. It is a pleasure to be part of this event. And as we come to the end of this Mental Health Week, I commend the organizers and express my gratitude to all those who participated and made this week a success. Thank you for your effort in promoting health and well-being of our community. We have been told at least over 500 clients came and they received their services. This is a great contribution towards achieving the vision of our county Department of Health, which states a healthy county. And you know you can't have health without mental health. I also want to thank the mental health professionals who provided the counseling services and shared their knowledge and expertise during this week. This initiative has reminded us of the importance of prioritizing our health, both physical and mental. In particular, I want to highlight the importance of mental health as a crucial aspect of our overall health. And just like our physical health, it requires attention and care. Sometimes we may experience difficulties that affect our mental health, such as stress, anxiety, depression, trauma, or relationship issues. When we face such challenges, seeking support from a mental health professional can be an effective way to cope and to recover. Research has shown us that psychological counseling can have a significant benefit for mental well-being. It can reduce the symptoms of anxiety and depression and improve their self-esteem and confidence. It can also enhance communication and interpersonal skills and promote the resilience and coping skills. Counseling also provides a safe and non-judgmental space for individuals to express their thoughts and emotions, which can be a therapeutic in itself. However, it seems to know that seeking counseling does not mean that we are weak or incapable of managing our lives. Rather, it's a sign of strength and a willingness to take care of our mental health. In fact, many of successful people have sought counseling to overcome challenges and achieve their goals. Community Health Week like this one provides us with access to mental health resources and services, including the psychological counseling, which counseling provides a safe and non-judgmental space, and all of us explore our thoughts, we explore our feelings or behavior, and work towards the goal. It is a social service that can help us manage our mental health problems. And we live in a healthy life. If you are experiencing challenges with your mental health, I encourage you to consider seeking support from our mental health professionals, who are the counselors. To contribute to mental health wellness, the county department, under the leadership of His Excellency the Governor Susan Kihika, has implemented various programs and initiatives that aim at providing mental health support and resources to our community. And some of the initiatives include the county government has established the mental health clinics within our major sub-county and county referral hospitals, where people can access mental health services such as psychological counseling. They can receive their medication and also have the interventions. The county government has prioritized mental health education, and we have incorporated mental health awareness programs, that is in schools, workplaces, and other community settings. These programs help to reduce the stigma associated with the mental health problems and increase the awareness about the importance of taking care of our mental health-being. On mental health advocacy, the county government has been advocating for mental health policies that promote mental health wellness, we have been working with the stakeholders to ensure that our mental health is given the priority it deserves and that resources are allocated to support mental health services and initiatives. Over and above, the county government is investing in mental health research to better understand the mental health needs in our community and develop evidence-based interventions that address these needs. And for the whole of this week, I've not been able to join the event here, but I'm happy to report that I was also busy somewhere addressing an issue about mental health in the community. And one of these efforts is we have been training community health frontiers on problem management plus, which is a psychological intervention designed to provide early support for the people experiencing emotional distress. By equipping these frontiers with these skills, the county is taking an important step towards improving mental health outcomes for its residents. The Department of Health will continue working cooperatively with stakeholders, including mental health professionals, institutions for training like you, the St. Paul's and the Egerton, community organizations and advocacy groups to promote mental health awareness and support mental health services to ensure that mental health is given the priority it deserves. In conclusion, the county is committed in promoting mental health wellness in our community. We recognize that mental health is a critical aspect of overall well-being, and we are working towards creating a community where mental health is valued and support is readily available. I encourage everyone to take advantage of the services and the resources available, particularly in the areas of mental health. Let us prioritize our health-seeking supports when needed and work towards living a healthier physically and mentally. Together we can create a community where mental health is valued and where support is readily available to those who need it. Otherwise, thanks so much for listening, and I appreciate all of you for making this day or this week successful.